I was having some visual symptoms. You know, I had kind of this weird eye crossing thing that was going on, and it would make me really dizzy and really nauseous. But I also had some imbalance and some headaches pretty much all day long. I saw Dr. Miller and she said, "I can fix you."
I'm Dr. Brett Miller. I'm the Director of Vision Therapy Services at Triangle Vision's Optometry. When I'm looking at patients who may benefit from vision therapy, we look at two different aspects of vision. We look at how well the brain tells the eyes to go gather information, and then how well the brain uses that information that comes from the eyes, just so that visual information is meaningful to us. You know, that Snellen chart, that eye chart you look at 20 feet away, only catches 5% of visual conditions that could be impacting your child's learning. To look beyond kind of nearsightedness, farsightedness, and astigmatism, because some aspects of vision aren't affected by clarity, and those are the skills that really help a child learn, an adult be successful in the workplace, and an athlete to be successful on the court or on the field.
Since starting vision therapy, I have noticed my work life has improved, my home life has improved, and I'm not as cranky as I was. I'm noticing more and more things that weren't there before that are. So even just at home, the paint colors look different, the furniture looks different. I saw Brett, it was a couple weeks ago, and I said, "I can see the trees." And she laughed, and I said, "No, they're 3D, I can see the trees." I don't struggle to see things as much as I did before vision therapy started.
We have families do a questionnaire. The questionnaire allows us to really look at visual processing and other just classroom struggles that could be caused by vision struggles.
It was kind of difficult for me to read. Words would blur up.
My daughter came out with better reading levels and with better vision, less headaches.
The words stayed clear and they didn't move around the page anymore.
She enjoyed vision therapy a lot. It was a lot of fun for her, so that definitely kept us coming.
We help with visual tracking. So visual tracking is really important. That's probably the most common thing we treat through our therapy program. Tracking skills are super important to allow the child to read across the page accurately, to not skip around. One thing that we work on is helping a patient's visual processing. So a lot of patients are almost careless with their vision. They're not really using that information and depending on it. So kids, sometimes they'll see what the words before what they just read said and almost guess what the word on the page is. We do a lot of activities where we're helping them really engage with visual information that helps them see similarities and differences between the word of and off, it and if, and even differences between letters that look similar, like B and D. And those activities, we try to make them fun. We try to make them games and things they really enjoy doing so they want to come see us each week. When you do many of those activities, it transfers to the classroom and they begin to read what's actually on the page.
When I was younger, I would actually YouTube videos of people reading parts of textbooks or articles that were assigned so that I could complete my homework without having to read any of the assigned material. I remember reading and seeing parts of words just disappear completely, or they come flying off of the page towards me, or are so blurry and overlapped that I couldn't focus. If I had had vision therapy when I was younger, I would have made it through high school and my college career a much more confident student and much more secure in who I was as a person.